I am from Jamaica, and so I learned many things from many different countries that come here, and they talk about their own experiences in cardiology, and I will take that back with me.
I really am expecting to hear great science and quality work and interact with colleagues from all over the world.
The posters were very interesting, mainly the posters in the basic science. I had very interesting discussion with a few of the authors.
For the next day, hopefully more of the same. So talking to more physicians, learning about the scientific sessions that are going on, and just discovering what's going on in the world of cardiology right now.
Four new ESC clinical practice guidelines are presented in Rome on dyslipidemias, cardiovascular disease prevention, atrial fibrillation, heart failure, and an ESC position paper on cardio-oncology. New interactive battles are held in the Gladiators Arena between leading keynote speakers on controversial issues, and the audience votes for the best argument presented. The ESC and the European Resuscitation Council are offering delegates 90-minute workshops on CPR and AED based on in-hospital scenarios with the latest ERC guidelines.
So that was our objective. We wanted to determine the clinical effect of that on hard endpoints in an adequately powered study of decent duration. Thank you very much.
The MHF study is the world's largest study of weekly remote monitoring of patients with heart failure and an implanted device, CRT or ICD. In our study of 1,650 patients, we found no evidence of improved outcome on mortality or hospitalization for these patients when we looked at the data each week. So the key conclusion of our study is, do not organize your department to look at the data every single week. That does not translate into better outcome for your patients. Use remote monitoring sensibly and not as a systematic approach every week.
This year's ESC Spotlight, the Heart Team, highlights the importance of teamwork and interactions between all professionals and specialities involved in managing patients with cardiovascular disease.
This session which is focused on what's new on the 2016 clinical population guidance.
It is a distinct pleasure to be here. On behalf of
The overview is that every patient should have access to 5 domains of treatment for AF. Acute treatment in hemodynamically unstable patients with rate control and cardioversion. Treatment of underlying cardiovascular condition, including its detection, for example with an echo. Anticoagulation in patients who are at risk for stroke, which is definitely indicated with women with a Charts-Vasc score of 3 and more and men with a Charts-Vasc score of 2 and more, and should be considered in those with 1 Charts-Vasc factor. Rate control therapy aiming at an initial heart rate of below 110 beats per minute, and then should symptoms persist, adaptation of rate control and initiation of rhythm control therapy, making use of cardioversion, antiarrhythmic drugs, catheter ablation and surgical options if needed. And these decisions should be taken by AF heart teams, which should be formed locally throughout Europe.
Actually, it was a very crazy concept, I must admit that, because we wanted to implant a valve prosthesis within the diseased calcified valve on the beating heart using percutaneous catheter-based technique and local anesthesia. This was the goal.
Meet the Legends gives cardiologists the chance to interact with true legends who have changed the landscape of modern cardiology.